You alright, guys?
Yay!
Yay! You alright? We're back for another episode, and this week we're going to be talking about cystic fibrosis, kind of expanding onto other disabilities. And Michaela, this is something that you've always said, you feel quite close to. You have a lot of friends who have cystic fibrosis, and you say there's like an affinity.
Yeah.
Is that correct?
There's a little, I think there's a lot of unknown parts between SMA and CF. Then we'll talk about that. You'll see why.
Hopefully we're going to discover this today. In Solomon's absence, Solomon's taking a day off today. So we have special guest on the podcast, Andy Ward. Do you want to introduce yourself?
Hello, everybody. I'm Andrew Ward, Andy Ward, whatever you want to call me. I'm number 37, and I was born with cystic fibrosis.
Good stuff.
Yeah, we're going to talk a bit about that today. I don't know, Michaela, do you want to lead a little bit on this one?
Yeah, I want to take this over because I think I've kind of grew up around CF, so it's something that I kind of have always had a certain knowledge of. But within the realms of technology, I think I've got more and more deeper knowledge.
Say, if there are any first-time listeners, do you want to explain, you have SMA muscular dystrophy, well, spinal muscular atrophy as it's called, but it's a form of muscular dystrophy, and essentially you've been in a wheelchair your whole life, and you have problems with your lungs as well.
Yeah, I have SMA, which we all know is a form of muscular dystrophy, and for anyone who doesn't know me personally, it's important to understand that my lungs have been probably the most prevalent symptom. So I can average maybe 4 to 5 pneumonias per year, depending on weather and different bits and pieces. So it depends what's going on with me as to what happens with my lungs. But that's probably the number one symptom for me. Because of that, I have seen an awful lot of people and my family have seen an awful lot of people with CF over the years. The ward that I'm in now, I quite often end up in the CF unit part, because that's where I'm best fit. So because of that, I think I have a bit more of an affinity with CF than maybe I do with what?
An honorary CF.
Yeah, I said that's where you best fit. It's like, they're as crazy as I am. So where should we put Michaela over there?
It is great when it's like 1 o'clock in the morning. We all have our TVs on. It's great. It's one of those things you maybe don't realise that there is a connection, and hopefully people will understand it. So I wanted to start with Andy talking about explain what CF is for people, so that we can understand it. Yeah. In that sort of way, in terms of the lifestyle and what it's like to actually live with CF.
Right. Well, I hope you're sitting comfortably then, because it's probably got quite a bit to say.
You could just listening to me.
Prod me or something, or if I go off on a tangent, it's something like that.
Hey, this podcast is built on tangents.
Yeah. So anyway, basically, cystic fibrosis is the UK's most common genetic disease. So how that works is that 2 people have to have the carrier gene, and then if they have a child, it has a 1 in 25% chance of being born with cystic fibrosis. So, for example, my sister doesn't have it, but I do have it. And there's currently around, I think, 10,000 people with cystic fibrosis in the UK. Primarily affects lungs, but it is a multi-systemic disease, so it pretty much does affect every part of your body. Every single person that has it can have it differently, and it can affect you differently each day, from hour to hour. And it's quite a nasty little disease, really. I'm quite lucky to have lived as long as I have with it, because it's incurable, and the current average life expectancy is around 40 years old.
14, I see. So in terms of the condition, is there anything that makes it different for different people? I mean, we know there are 60 different types of muscular dystrophy, for example, but, Michaela, you have SMA muscular dystrophy, and yours varies.
There's 4, 5, 6 types of.
Yeah.
The types of SMA are growing, so there seems to be more and more common. So is it the same in CF?
Yeah, it absolutely is. The CF gene has different mutations. So I think there's currently around 2,000 different mutations, and depending on what mutation and gene that you have, that defines the severity of the illness for a lot of people. So that's quite a wide range, and then those numbers will always be increasing.
Yeah. I think, I've known I've known like one or two people with CF, or I've heard of them, that their only issue maybe is infertility.
Yeah.
Where it clogs the reproductive system with the mucus that renders infertility. Like, it can be that simple, or it can be the full system, lungs, digestive tract, pretty much everything.
So you can get very minor forms of cystic fibrosis then?
Yeah, you can get
Yeah.
very, very mild forms of CF where what often happens is people will have the very, very mild forms of it and spend most of their life undiagnosed. I've known people be diagnosed at 21. I think there was a patient at our unit who was diagnosed in his 50s.
Wow.
I know somebody who was diagnosed in his 40s, and depending on what services are available at people's hospitals, because it is obviously very different services from hospital to hospital. A lot of the symptoms get misdiagnosed or just don't get diagnosed at all.
That's something very common with muscular dystrophy with people.
Right.
Sometimes there are diagnoses that people don't even have a diagnosis, and that's it's just like you have something like this. I guess with cystic fibrosis, would it be just people just think it's asthma or something like that?
Yeah, it can be asthma, it can be bronchitis, it can be those kind of general chest type problems. I was very lucky. I was diagnosed at 4 days old because I was born and I wasn't putting weight on like a normal baby should do. So back then they did the sweat test, and that can screen for different types of illnesses and conditions, and it came back as positive for cystic fibrosis. A lot of people do go a long time without being diagnosed.
And just thinking about the diagnosis as well, so you're diagnosed at 4 days old. What was then the procedure for your parents? What was the procedure for you? Did they then say, right, you've got to come back every few months, and did you need immediate treatment, or was it this kind of waiting game for it to kind of kick in?
Now, basically, what happened with me was, obviously I don't have memories from that young, but I've asked my mother, my mum's told me...
I struggle to remember 4 days as well.
Yeah. My mum basically said that I was diagnosed, and I wasn't putting on weight, like I said, and I then spent the first 6 months of my life in hospital whilst I was trying to, get a treatment plan in place. And back in 1978, knowledge and the treatment for CF was, nothing like it is today. So it was still very much in the early stages. So it was quite difficult to treat. I mean, it still is incredibly difficult to treat, but 37 years ago it was, massively nothing like it is now.
And how do they treat it? What sorts of things would you have at that age? Is it because I know that there's sort of lots of physio type things.
Yeah.
Are there drug treatments as well?
Yeah, I mean, the treatment for CF, it starts straight away. Back then it would have been imperative that they keep me as stable as possible. So dealing with the weight issues, I probably would have seen a dietitian and started some form of enzymes to help digest my food and put weight on. The lungs are still developing when you're a baby, so it's such a crucial stage. Things like that, and I've known people. I mean, I've got a lot of friends on people like Facebook and things like that. A lot of CF parents, and their children are starting treatment from day one. It is very much a start treatment from day one kind of disease. No matter what, as long as you obviously you've got to be diagnosed, so it's imperative that you are diagnosed as quickly as possible with it, and you can try and slow it down.
And I mean, so how severe is it? So you say you started treatment from near enough day one, and obviously you've lived quite a long time with it. If you hadn't have had treatment there and then, would your life have been at risk immediately?
Absolutely. Yeah, I mean, I know a friend on Facebook, and she had a transplant at 6 years old.
Wow.
Again, it's the severity thing. It depends on what gene type you have, and obviously the medical knowledge back then wasn't as advanced as it is now.
Yeah, and when we talk about transplants here, are we talking always about lung transplants? And is it both lungs, one lung? Is it different sometimes? And also, I guess, would a lung transplant cure someone of this, at least temporarily cure them of it?
No, there's absolutely no cure for cystic fibrosis, no matter. With regards to transplant, it's kind of like putting a new engine or some new tyres on your car.
I see.
So because the disease is genetic in its nature, transplant doesn't cure the underlying gene problem.
Yeah.
So basically what they said to me is the doctor came in and he says, right, you're at your transplant stage now. So basically your lungs are now at the point where you statistically you might have 2 to 3 years left. It's imperative that you get a transplant, but then when you get a transplant, there's a lot of risks and complications involved with that, but then you have to wait up with that. If you don't get a transplant, then you're going to die. There's no bones about it. That's what's going to happen, and I don't want to die. I want to keep living. Now there's a lot of things I want to do in my life still.
So thinking about this now, so you're in your mid-30s now, and you've gone as far as you've gone without ever needing a lung transplant? Or is it that you could have, you would have liked to have had one earlier, but it's just there's a waiting list, so it has to be sort of imperative for you to get put on that waiting list? Is that the way it is?
No, I think as a general rule, most CF units say that when you get to around 30% lung function, then they start to think about transplant for you. So again, this is the thing with everybody having it differently. On paper, my clinical statistics and data is quite severe. I'm at end stage, but physically I'm still quite strong. I am having quite serious bouts of ill health now where when I am getting poorly, I can literally do nothing. My lung function is dropping to around 14%, which is really low. So they kind of have that as a benchmark that when you get to that point, you need to be assessed for transplant. So I had my first assessment about 2 years ago. And at that point, I was still quite active. Still had a lot of independence, had quite a good quality of life, which is one of the main things that they judge it on. And they basically said, go away, you're too well, you're swimming loads, you're quite active. One of the doctor's jokes, that was fitter than him. And we went away relieved, but also we knew that it was on the horizon at some point. So I then had another one the year after, which again, I was quite well. My lung function was around 37%. And then this past winter, I've had quite a bad spell. And to be honest, the first 6 months of this year have been pretty bad for me health-wise. I've had quite a serious infection in January, which damaged my lungs quite a bit. It took about 3 months to just get over that. And then I tested positive for MRSA, so I had to go for the full decolonisation procedures for that, which made me really, really ill because I had an allergic reaction to the drugs, but I had to take them. So it's been a bit of a tough time. So I just stepped back, thought about it, and thought, this is absolutely the right time now, because you have to be sensible and you can't be stubborn about it, because it's really crucial that you stay as stable as possible to get to transplant. And because you don't know how long you're going to be waiting, I could get a phone call whilst we're on doing this in 5 minutes, which would be quite exciting. But at the same time,
well, finish the podcast first.
I could carry on the podcast in the ambulance. That'd be great.
Would be one heck of a podcast.
Or I could be getting one in 2 years, and I have no idea. I haven't got a crystal ball. You've no idea how well you're going to be in 2 years or anything. So it's a massive amount of things to think about. Just to address the point that you asked, you do have both lungs transplanted unless there's a problem with your heart. I mean, I'm not quite sure, but it used to be that you had your heart and your lungs transplanted, but now, as far as I know now, it is just both lungs.
Tell me this, what about, I know there's been a few people that have maybe had a pancreas or liver transplanted as well. Is that common, or is it, where does that come from? And I suppose people don't really think about the amount of drugs that you need to keep your body kind of in that fit shape for as long as possible. But I think it's really important for people to hear about the liver and why that takes such a hit too sometimes.
Yeah, because CF's, like I said, a multi-systemic disease, and the first line of attack is the lungs. But a lot of people do have bowel problems, and because of the toxicity of the antibiotics that we have to take our entire lives, a lot of people do develop liver problems as well. So it's not uncommon for people to need liver transplant or a pancreas transplant. I've got a friend at the moment who she needs a pancreas transplant, and I've known a few people have liver transplants as well. So, it does affect every organ, and the treatment also affects your body. For me personally, primarily is just my lungs problem. I'm quite lucky with that. I don't really have any of the bowel problems or liver problems or anything like that. And, like you said, I try to look after every part of my body as much as I can.
Yeah, I think it's really interesting to just get into transplant and to be an assessment for a doctor to say actually you're fitter than me, but people don't realise how much you put into exercise and how much you put into that kind of element.
Yeah,
Because, I
that's
mean,
what I was
you were
going to
doing a lot of
say.
that.
Yeah, so I
Yeah.
was going to say your road to needing a transplant, it seems you got quite far on without needing a transplant. If there's other people listening who might have a child diagnosed with cystic fibrosis or whatever, was your road to needing a transplant, was that set that you were always going to need one around, mid to late 30s? Or was it that you put it off or were able to push it back through doing good exercise, having a lot of kind of physio and everything else?
Yeah, absolutely. I can't underline how important it is to be fully compliant with your treatment regime and to exercise. And, I mean, that you're always told from birth, you've got this illness, and at some point in your life, you are going to need a lung transplant. So I kind of basically just accepted that from a young age, which I think freed me up a lot to not worry about it as much and to kind of live my life and just basically grab life and enjoy it.
Yeah. So there could be like an alternate version of you, another Andy Ward who sort of didn't do as much exercise and whatever, and maybe needed a transplant at the age of 20.
Yeah,
That's crazy.
exactly.
Wow.
But I mean, there's so many different variables for it. I mean, the treatment is a massive, massive thing, but a lot of it is just down to luck. I've known people be fully compliant and be really into fitness, and all it takes is one bad infection. It's what happens every time you have a cold or a chest infection. It can permanently scar your lungs, permanently knock your lung function down. I've had friends that have just been unlucky and caught flu and unfortunately passed away when they've had a fairly reasonable lung function, things like that. It's a lot of luck, but also a lot of emphasis and dedication on your treatment and being compliant with it.
I knew whenever I was at college studying journalism way back in the day, and the secretary that I used to have my work to, she was telling me that her cousin had CF, and he went through his whole life really, really healthy. And he never needed to be admitted for even like a tune-up. He never was admitted for a tune-up. He was really good. And he went around holiday and came into contact with Pseudomonas. And that was him, and within 5 years, he was gone. You get people like that as well that maybe more serious delusion, but are really lucky to not come into contact with anything.
So what did you come into contact with?
He came in contact with a really nasty bird called Pseudomonas, which I have had a form of, but it won't hit me as severely.
So what you're saying as well is that cystic fibrosis can leave you much more open to other illnesses. Is that immune system wise?
Basically, with CF, we all grow different bugs in our lungs, just like everybody else does. Normal people as well as people with CF. But some of the bugs that are in the environment and that people naturally grow in their bodies can be incredibly damaging and harmful to people with CF, which is why all the cross-infection and segregation rules were brought in to protect us and things like that. So, for example, what generally tends to happen is that at some point in your life, you will catch a bug that becomes, kind of your bug, your badge. It could be Pseudomonas, it could be staph, it could be anything really. There's certain bugs that are incredibly dangerous and can severely affect your health, such as B. capacia and Mycobacterium abscessus, which if you get those as well, they can be transplant killers. They will not transplant you with those because they're incredibly hard to treat because they're resistant to antibiotics. So you're not only are they damaging your current lungs, but if you were to get a transplant, they would potentially destroy your new lungs as well. So there's a lot of risk, which is why, we have to be really careful around people. We have to segregate ourselves. A lot of the CF units have brought in segregation and cross-infection, measures which people were initially really resistant to, which I completely understand because I've lived through a time where we could mix with each other and we could be there for each other. But unfortunately now, they're really big on minimising the risk to patients, which I completely support because you don't really want to be responsible for giving somebody a bug which could potentially kill them, and obviously you don't want to catch a bug that could potentially kill you as well.
So have you never sort of hung out with someone who has the same condition as you?
Yeah, absolutely. I mean, I can't sit here and say, cross infection is bad, don't do it. I grew up in a time when we were allowed to mix, and it was brilliant. It was fantastic. It really helped you get through hospital admissions, and have friends outside of hospital life that, if you live nearby, it was easy to see, and they understood, because people just don't understand. It's one of those things where, I'm sure like a lot of disabled people will, find this to be true, that unless you actually have the condition, you just don't understand it. You can be a doctor that spent his entire life researching this condition, or you can read hundreds of books about this condition, but unless you actually have it, you just don't quite understand it. So that's incredibly difficult for a lot of people.
Yeah. Is there like online things where you can all chat to each other about things and talk through it that way?
Yeah, absolutely. I actually wrote my undergrad dissertation on the expanse of social media to help fill the gap that the segregation had caused, the vacuum, because the CF Trust brought in the segregation and cross-infection policies in 1996, when they discovered that there was a strain of chronic Pseudomonas going around that I tested positive for, a lot of people tested positive for. So they decided to just implement cross-infection and segregation as a means to, just basically protect everybody. So that was hard for a lot of people to adjust to, like I said. But with the advent of social media and Skype and Facebook and Twitter and Instagram, I personally now believe there's just no need for people to meet up in person. And I tried to do a lot, to promote people living a life away from the disease first, living a life, trying to live a normal life, because there's still a lot of people, it is still really isolating and things like that. But the bottom line has to be that you have to protect yourself, and you have to protect other people's health as well, because when you get to this point where you're a transplant, you're first of all incredibly lucky to even get here, and secondly, you don't really want to do anything to ruin that, or to be responsible for ruining that for somebody else,
Yeah, I've actually heard of a lot of the chat rooms that they have, and forums and everything else. I think that sounds like a fantastic way of sort of joining together as a community to talk about things that things that you're going through together. I guess that must really help in so many ways.
It does, it really does. You can, obviously we're Skyping together now, and we can all broach issues that affect a wide range of people, and support each other and things like that. And obviously there's phoning and things like that, and I just think it was great. It was great whilst it lasted, but at the end of the day, it's a hospital environment, and you try not to be as resistant. A lot of people are resistant to it, but really I can't underline how important it is to look after yourself. And I think I approach things with, I've got a personal responsibility to myself and to the people that I care about, that I've got to do my absolute best to stay as well as possible and as long as possible. And I've also got responsibility to the NHS and to the staff of the wards and to the facilities that I'm really lucky to use and that are there to help treat me and to get me better. And, I don't want to jeopardise any of those things by mixing with people and, like I said, risking hurting them or hurting me or hurting the people I care about by catching a bug, but some people choose to mix, and, I think a lot of people, I'd like to, think that there would be a move away from mixing now, because there's just no need for it. There's CF Trust are doing fantastic work to try and keep everybody connected and social media, and there's just no need for it now.
I think as well, like to CFOR Twitter as well, you've got this whole other network as well, where people are inside in hospitals and they're bouncing ideas off one another across different parts of the world, which is really crazy but really unique. And you get a lot of things like that actually make a world of difference. And although I have SMA, I've seen me tweet CFOR asking for advice about a portapat or advice about a drug or of things like that. And nearly my first protocol would be the CF community.
I think
the depth of knowledge is so deep.
I think in the last 10 years, I think the CF Trust, really has invested in the psychological side of the illness, which I think is helping people a lot, because I totally understand that it's this incredibly hard disease to live from especially when you're a teenager and you've got all your usual teenage problems and about your identity and finding your place in the world and who you are, but also to have this weight of this disease, pushing down on you as well. I can completely understand why people want to mix and things like that, but in my experience, it's really vital to have a life away from the disease and outside of the disease for as long as you possibly can. And I truly believe that has helped me fight it a lot longer, because I'm sure, like, as with any disease, it just gets incredibly boring talking about it all the time. It all being about CF this, CF that, or whatever disease it is that you've got. You've got to try and carve out a piece of life or a piece of the world where you don't have that around you.
I suppose what you're saying is that it's kind of there and it's part of things, but it shouldn't define everything.
Yeah, absolutely. I mean, yeah, absolutely, yeah. Like I said, when I just accepted at a young age that I had it, and there wasn't very much that I could do. But on the flip side of that, I wanted to have a life first, and the disease to come secondary, and just basically live my life as much as I could. And it's only really in my late 20s, early 30s that it has started affecting me. But I still, now to this point, still try to do everything that I can do and try to be as independent as possible. And that's really helped me. So all I can do is try and speak from my own personal experience, and I hope it helps other people.
Yeah, I mean, you talk about living as much of an independent life as you can. How does cystic fibrosis kind of... Right, now that's all for part 1 of our episodes on cystic fibrosis. We really hope you enjoyed it. Tune in next time for part 2, where we'll continue the discussion and be talking more about the wider scope of disabilities. If you did enjoy it, you can find us on Twitter and Facebook. Give us a like and a follow. Thanks so much for listening. See you next time.